When patients breathe through a tracheotomy, airflow bypasses the nose, which is the natural filtering, humidifying, and warming organ of the body. This has a significant negative impact on the pulmonary physiology. A heat-moisture exchanger, or HME, can act as an artificial nose and maintain the health of the lungs. HMEs are extremely important for the tracheotomized patient, and their impact on reducing pulmonary secretions cannot be emphasized enough. While it is true that speaking valves help addressing some of the side effects of a tracheotomy, including loss of speech, loss of smell, difficulty swallowing, they do not help with three critically important side effects of a tracheotomy, namely loss of humidification, loss of warming, and loss of filtering of unwanted particles from the air. In normal patients who did not undergo a tracheotomy and who breathe through the nose, the inhaled air is warmed by the nose, and by the time it reaches the lungs, it has been warmed to approximately 90 degrees Fahrenheit, humidified to approximately 100% saturation, and filtered to substantially free of dust, germs, and particles. In the tracheotomized patient, inhaled air goes through the tracheotomy tube bypassing the nose. The air that reaches the lung is colder and drier, with a temperature of approximately 68 degrees Fahrenheit and a saturation humidity of approximately 42%, and it contains unfiltered inhaled particles that include bacteria, viruses, dust, and other environmental airborne pollution irritants. One problem with all flapper-type speaking valves is that they cannot work in unison with an HME, as HMEs can draw moisture only from exhaled air. All flapper-type valves are by design 100% closed upon exhalation, and exhaled air from the lungs cannot pass through a flapper-type valve, so it cannot reach the HME to moisturize it. The Shikani speaking valve solves this problem, since when placed in the 12 o'clock notch up or bias open position, it allows airflow in and out through the valve with each inhalation and exhalation. With the Shikani HME used in unison along with the Shikani speaking valve, exhaled air can easily pass through the speaking valve and bring humidity and moistures from the lung to the HME. The hygroscopic foam inside the HME will hence absorb the exhaled moisture and then return it to the lungs upon inhalation. It is important to remember that the Shikani speaking valve must be placed in the 12 o'clock notch up position with the ball sitting posteriorly to allow the patient to breathe in and out in a soft, normal way and exhaled air to go through the valve and reach the HME. When the patient wishes to vocalize, a slight ordinary exhalation force, like the one we all have when we normally speak, is all what is needed to cause the ball to move forward and close the frontal opening of the valve, hence redirecting the air through the larynx. This permits the tracheotomized patient to use the Shikani HME in unison with the Shikani speaking valve and to control when to breathe and achieve air humidification and air filtering, and when to redirect the air to the larynx and speak without having to disconnect the speaking valve from the HME. A true revolutionary clinical concept.